High blood pressure often acts so discreetly that millions of people live with it without realizing they are facing a real risk. Many times, small everyday discomforts seem normal but hide a growing danger that can affect the heart, brain, and even vision. The big problem is that when the signs finally become strong, it may be too late. That's why recognizing early warnings is essential. Today, you will discover 5 subtle signs that almost no one notices, but that may indicate something serious is happening. And the first one may be much more common than you think. Before we move on, it's important to remember that these signs don't appear out of nowhere. They show up subtly, spreading through the body like small warnings asking for immediate attention. You will notice that many of them resemble simple everyday symptoms, which increases the risk of being ignored. But by understanding each of them, you'll have more control over your health and will be able to act before an emergency happens. Stay with me, because the next topic reveals exactly what you need to know to protect yourself today. What high blood pressure really is and why it is so dangerous. High blood pressure, also called hypertension, occurs when blood flows with excessive force inside the arteries, causing the heart and vessels to work harder than necessary. What many people don't know is that this elevated force silently damages the vessel walls, paving the way for strokes, heart attacks, and kidney problems. Because it is a condition that almost never causes immediate pain, most people only discover it when some damage has already occurred. Understanding this mechanism is the first step to recognizing that subtle signs are not mere coincidences, but rather the body's own cry for help. When blood pressure rises repeatedly, the body tries to adapt, but this adaptation comes at a high cost. Over time, the heart becomes more overloaded, arteries stiffen, and important organs receive less oxygen and nutrients. That's why seemingly mild symptoms can indicate something much more serious. By understanding why hypertension is so dangerous, you begin to see its signs with more clarity and urgency, and that is essential to avoid normalizing small discomforts. In the next topic, you will discover the first subtle sign that many people ignore. If this content is helping you, take a moment to like the video and subscribe to the channel to receive more videos that protect your health. Subtle sign 1. Persistent headaches that go unnoticed. Headaches related to high blood pressure usually appear mildly, repeatedly, and often at similar times of day. Many people attribute this discomfort to fatigue, stress, or lack of sleep, but when these headaches become frequent, especially upon waking, they may indicate that blood pressure is not functioning normally. This happens because increased pressure inside the vessels of the skull creates greater tension, which the body turns into pain. Even though it's a common symptom, it should not be ignored, as it may be the first warning that something more serious is developing. As days pass, these headaches may begin to follow a pattern. Some people report a sensation of heaviness in the head, pressure in the neck, or discomfort that appears without a clear reason. The danger lies in the subtlety. Because it seems like something simple, many people don't seek help and let the problem evolve. When these headaches persist, especially accompanied by fatigue or blurred vision, it's essential to measure blood pressure and observe how the body responds. In the next topic, you will learn another even more discreet sign that many people only notice when it is already advanced. Subtle sign 2. Mild and occasional shortness of breath. Shortness of breath associated with high blood pressure often appears during the simplest moments of the day, climbing a few steps, walking short distances, or even while talking. Many people interpret this discomfort as getting older or just temporary tiredness, but when it happens repeatedly, even mildly, it can be an important warning. This occurs because hypertension forces the heart to work harder, and when it cannot pump blood efficiently, breathing becomes shorter. It's as if the body is saying something isn't working as it should. Over time, this shortness of breath may occur even at rest, which indicates greater cardiovascular strain. Because it comes and goes, many people normalize it and don't associate it with high blood pressure. However, ignoring it can allow the condition to progress silently. Paying attention to these small changes in breathing can prevent serious complications. And in the next topic, you will see how another unexpected sign can appear in daily life without raising suspicion. Subtle sign 3. Vision changes that come and go. Vision changes caused by high blood pressure generally appear as small blurs, momentary difficulty focusing, or flashing lights that show up out of nowhere. These episodes last only a few seconds, And because they disappear quickly, many people believe it is just eye fatigue. But when blood pressure is high, the vessels in the retina struggle with the excessive force of blood, causing these temporary visual disturbances. It is one of the most ignored signs, precisely because it doesn't cause pain and seems temporary. However, each episode may be a warning that blood pressure is rising more than it should. With time, these changes may become more frequent, especially during stress, physical effort, or after many hours without rest. In some cases, vision may become blurry when getting out of bed or while doing simple activities like reading or watching TV. This happens because hypertension reduces blood flow to the eyes and compromises visual function. When you notice this repeated pattern, it's essential to measure your blood pressure and seek guidance, because vision is one of the first senses affected. In the next topic, you'll understand another sign that many attribute to aging, but that can indicate real risk. If this content is useful, like the video and subscribe to keep receiving videos that help protect your vision and health. Subtle sign 4. Sudden dizziness during daily activities. Dizziness linked to high blood pressure appears suddenly, like the floor moving for a moment or the body losing stability for a few seconds. Many people say it's just weakness or standing up too quickly, but when these episodes start occurring repeatedly, even during rest, they deserve attention. Hypertension can alter blood flow to the brain, causing these brief imbalances. And because they last so little, they are easily ignored, allowing the problem to progress. As days go by, these dizzy spells may appear when changing positions, walking, or even while sitting. The biggest risk is that, besides indicating high blood pressure, this instability increases the chance of falls, especially in people over 50. That's why it's essential to notice when they become frequent or when they appear with blurred vision or palpitations. These details help differentiate something temporary from something important. In the next topic, you will learn about a sign many attribute to a busy lifestyle, but that may hide a silent danger. Subtle sign 5. Excessive fatigue without explanation. Fatigue caused by high blood pressure is different from the tiredness of a busy day. It appears even after light activities such as tidying up the house, walking a few minutes, or performing routine tasks. Many people believe it is just lack of sleep or stress, but when the body becomes exhausted too quickly, it may be a sign that the heart is working extra hard. Hypertension requires more energy from the body, and this creates a constant sense of weakness, as if the body were always at its limit. Over time, this fatigue may become daily, causing a person to lose motivation for activities that once were simple. It's common to feel low energy upon waking, needing frequent breaks throughout the day. This happens because circulation becomes compromised and organs receive less oxygen. This type of exhaustion should not be ignored, as it indicates that blood pressure may be chronically high. In the next topic, you will learn how all these signs connect and reveal a much clearer picture than it first seems. How these signs connect and reveal a greater risk. When we analyze these 5 signs together, it becomes clear they are not random. Each one represents the body's response to the extra effort caused by high blood pressure. Headaches, shortness of breath, blurred vision, dizziness, and extreme fatigue work like pieces of a puzzle that, when assembled, show a picture of circulatory overload. Even though they seem mild on their own, together they indicate that the body is struggling to maintain balance under elevated pressure. Understanding this connection helps you realize the problem is more serious than it appears. Additionally, these signs complement each other because they reflect different parts of the body being affected simultaneously. The brain, heart, eyes, and breathing send alerts, quiet but constant, showing that hypertension is progressing silently. When you recognize this pattern, it becomes easier to act quickly and seek proper evaluation. Many emergencies could be avoided simply by paying attention to these details. In the next topic, you will learn who is at greatest risk of developing these symptoms and why. If this video is helping you understand your body better, like the video and subscribe to keep receiving content that can transform your health. Who is at greatest risk? Age, habits, and family history. High blood pressure affects people of all ages, but the risk increases significantly after age 50. This happens because, over time, arteries lose elasticity, making it harder for the body to maintain balanced circulation. Additionally, people with a family history of hypertension are more likely to develop the condition even with good habits. This genetic factor is silent and often unknown, which makes attention to subtle signs even more important. Lifestyle habits also have a major impact. A diet high in salt, physical inactivity, excess weight, chronic stress, and poor sleep all increase the risk of developing the symptoms described. People who smoke or drink alcohol frequently also fall into a higher risk group. When we combine age, routine, and genetics, we see a scenario where any small sign gains importance. That's why recognizing these symptoms early makes all the difference. In the next topic, you will learn what to do immediately when noticing these signs. What to do when you notice these signs. Immediate and safe steps. If you notice any of these subtle signs, the first step is to measure your blood pressure as soon as possible. Having a monitor at home helps a lot because it allows you to track patterns over several days. If your pressure is repeatedly above normal, seek medical attention for a complete evaluation. Often, small adjustments in your routine already make a difference, but only a professional can confirm whether specific treatment is needed. The important thing is not to ignore or wait for the symptoms to go away on their own, as this may delay care that prevents serious complications. Another essential step is observing when the symptoms appear. Writing down times, intensity, and frequency helps the doctor understand what is happening. Reducing physical effort until a professional evaluation is also recommended, especially if dizziness or shortness of breath occurs. Proper hydration, light meals, and avoiding stressful situations help stabilize the body while you seek guidance. In the next topic, you will learn simple and practical habits that can reduce blood pressure and improve your daily well-being. Simple habits that reduce blood pressure and prevent emergencies. Lowering blood pressure doesn't require drastic changes. Small adjustments, consistently applied, lead to huge results. Starting with your diet is a key step. Reducing salt, avoiding ultra-processed foods, and increasing fruits, vegetables, and natural sources of potassium help balance blood pressure. Light daily walks improve circulation and strengthen the heart without excessive effort. These habits create a solid foundation for your body to function with more ease and less stress on the arteries. Sleeping well is also crucial. Poor sleep increases tension in the body and elevates blood pressure. Taking deep breaths, pausing during your day, and avoiding accumulated stress help the heart work more calmly. Additionally, keeping a healthy weight and avoiding smoking reduce the direct burden on the cardiovascular system. These actions are simple but powerful and transform health over time. In the next topic, you'll see how to bring it all together into a daily commitment that truly protects your life. If this video is making a difference for you, take a moment to like and subscribe so you continue receiving content that strengthens your health every day. Caring for high blood pressure is, above all, a commitment to your future. The subtle signs we discussed throughout this video show how the body tries to warn us when something is wrong. By recognizing persistent headaches, mild shortness of breath, vision changes, dizziness, or unexplained fatigue, you gain the chance to act before the situation becomes an emergency. These small but recurring signals are invitations to look more carefully at your health and make more conscious daily choices. The good news is that, with simple and consistent measures, it's possible to reduce risks and live with much more quality. Medical follow-up, healthy habits, and attention to your body's signs form a powerful combination to protect the heart, brain, and entire organism. Every step counts, and today's care can prevent tomorrow's worries. Thank you for watching this content, and always remember, your health deserves priority every day.